This is not a repeal bill. This is sort of, hey, we're going to take Obamacare, replace it with Obamacare, but we're going to let the states have a little more power in how we spend it, but we're going to keep the taxes and keep the spending.
That's Republican Senator Rand Paul saying he will vote no on the GOP's newest bill to try to repeal Obamacare, saying it simply doesn't go far enough. Senators Lindsey Graham and Bill Cassidy are pushing that measure, which replaces Obamacare spending with block grants to the states. Vice President Pence flying back to Washington from New York to help build support for the measure, which looks like the GOP's last shot at repealing Obamacare without facing a likely filibuster. So let's bring in John Goodman. He's president of the Goodman Institute for Public Policy Research, and he likes the sounds of this proposal. Andy Slavitt is former acting administrator for the Centers for Medicare and Medicaid Services under President Obama, and as you might expect, he does not think much of this proposal. So, gentlemen, let's try to each make your best case without stepping all over each other. John, block grants to the states. Why do you think that that would work and cure some of what ails Obamacare?
Because under Obamacare, we have 30 million people who are uninsured, and it's going to stay that way for a long time because Obamacare is trying to force them to buy insurance, which is inappropriate for their health and financial condition. The workers at fast food restaurants all across the country are being told by their employers that if they want insurance, it's going to cost them 10% of their take-home pay and $7,000 deductible. If they want to cover their families, it's a $13,000 deductible. It costs a third of their income. These workers are saying no to that. And what this bill does is it gives the state the power to liberate these people, let them choose insurance that meets their needs, and even use some of the Obamacare money to help subsidize group insurance, which these days is a lot better and a lot less expensive than individual insurance.
Andy, do you disagree that it would work that way, that it would provide that kind of help?
Well, with respect to John, I think all this really is a chintzier version of Obamacare. It takes Obamacare and basically strips out a lot of the money that goes to low-income people in Medicaid, dramatically reduces the costs, and then does a big shift from blue states to red. It moves a lot of money into red states. So I have a hard time understanding how Republicans in New York and California are going to support this bill. And I'd make one more point. I think most people in America would like to see a bipartisan bill. I think Senator Alexander has done a good job to try to bring people together. Most people say that they're tired of the back and forth of one party to the other, and they would like to see Alexander have his shot at getting a bipartisan bill done, and I would.
You mentioned, John, that a lot of people are offered policies that are inappropriate to their medical needs. Essentially, I mean, the young people generally in this country are the healthiest group. You're saying that younger people are being forced under Obamacare to buy insurance they don't need?
Young, healthy families are being forced to buy insurance with unlimited coverage. So if they had a $3 million premature baby, the hospital gets the $3 million. But this family has a $13,000 deductible, and the insurance won't pay for 95% of everything that happens to it. So what we need to do is we need to let families decide what best meets their needs instead of the government making those decisions.
Well, John, sticking with you for just a moment, what do you say to Andy's point that this is a Republican bill and maybe some kind of bipartisan solution might be in order?
Well, I know that Senator Cassidy has reached out to a lot of Democrats, and there's no reason for Democrats not to support a lot of these changes. Now, for Democrats to come on board, maybe some things small things would have to be changed, but we've got to stop the death spiral. We've got to stop to the race to the bottom on quality where people don't have access to the best cancer doctors, the best cancer facilities. And we've got to stop trying to force low-income working families to buy insurance, which is totally inappropriate for their station in life.
Yeah, Andy, that is part of the problem. People throw these numbers around about the millions of people who don't have insurance or wouldn't have insurance, but a lot of those people are people who are choosing not to buy it because they don't like the deal that's offered.
Well, you know, Americans say overwhelmingly they don't want to go back to the days of Swiss cheese policies. So if you really wanted to do what John says and bring down the cost of insurance by stripping out benefits, the only real benefit you could strip out to reduce the cost would be pharmacy. Pharmacy is about 20% of the benefits. So everything else in there are just things like mental health, things of that nature that people don't really know if they're going to need, but they're also not very expensive. People really want to know that when they get a policy, they can rely on it, And I think Senator Alexander, is focused on trying to add state flexibility to his policy. I think we should let Senator Alexander run with it and make whatever changes that he can make. And I think at the end of this, if we live in a place where both parties are committed to making this thing better, we'll be better off.
There's a new move, Andy, among Democrats for single payer. Basically, the government pays for everything. Do you like that?
Well, look, I don't think that's what we should be debating right now. I mean, I understand that there's certain Democrats and certain faction of the Democratic Party that would like to see us continue to march towards universal coverage. I think there are not just the bill that came out, but Senator Brian Schatz from Hawaii and others will, I think, probably release more moderate bills, which will give people more options. You know, I don't think that the bill released from Senator Sanders is really material right now.
All right, but John, you think that this block grants proposal is the way to go, at least for now?
Absolutely. We have a real problem with a race to the bottom in the exchanges. MD Anderson in Houston is probably our best cancer facility. It doesn't take any exchange insurance, no Obamacare insurance in the state of Texas. Here in Dallas, where I live, Southwestern Medical School is our best facility, takes no insurance from the Obamacare exchange. This is a race to the bottom. And what this bill will do is it doesn't require the states to turn this around, but it gives them the opportunity to liberate the market from very, very perverse incentives.
All right. Good discussion, gentlemen. We'll see what the Senate decides on this proposal. John Goodman, Andy Slavitt, thank you both.
Thank you.